Hello everyone, my name is Dr. Hosni. I am a consultant ophthalmic surgeon in London with a specific interest in cornea, anterior segments and cataract. So today I would like to talk about one of the interesting cases that I had recently in my practice. Sometimes you face a patient who you did the DMEK for him, and after that everything looks fine, graft is attached, and the corneal thickness is getting better, but the vision is not improving. Sometimes after this happens, you need to check what else is going on. Maybe something happening in the back of the eye, maybe the high pressure during the putting the gas in the eye affects the optic nerve, or there is retinal detachment, cystoid macular edema. All this will come to my mind. But definitely there could be much simpler causes that can cause that I actually face in this case. So this case was a patient who had a very complex cataract surgery before with vitrectomy and anterior segment IOL. After that, he got corneal decompensation, and then he had a DSEK surgery. And after that, the DSEK failed and the vision comes down back with corneal edema. So he came to our clinic and we decided to do a DMEK for the patient. After doing the DMEK surgery, it was quite a complex case, which was not easy to unfold because of many causes. First of all, the patient had a very, as you see, fibrous graft from before was attaching very hard. And the graft that we put was for a young patient who is less than 50 years old, and it was deep anterior chamber, and it was the intraocular lens as well, anterior chamber IOL. So it took us time, but after that we used the bubble technique, and the graft have been unfolding successfully, and the patient graft was attached and very well. So after the surgery, it was surprising us that the patient was still counting finger with no improvement of vision. So we started to think about what other causes could be happening. We investigate the patient well. So we checked first the graft. It was quite well attached, as we can see. The corneal thickness is not too bad. And as well, we checked well the back of the eye as much as we can see, because there's still the visibility was a little bit hazy, but it was there was no cystoid macular edema, no retinal detachment, intraocular pressure was okay. And we think what else could be. So we just while investigating, we find as well like a very small detachment, which we were all convinced that this is not the cause of this problem. Still, we say, okay, we can try to rebubble this detachment and see what happened. But unfortunately, it haven't been improved after that as well. The vision stays the same. So we start to think what else we can see. While doing the MS-39, we find the Myers looking very distorted of the anterior segment of the eye. The placebo disc Myers look very distorted. And as well, we can see the epithelial map here is as well is not regular. So we think probably this was because it's a problem with the anterior surface and the dry eye. So we decide to remove this unhealthy epithelium and doing debridement under the slit lamp and see what will happen. And the surprise was that after doing this, the patient got a vision from counting finger to 618 on the spot, and she was really very happy. So we learned from this case actually that when you have a graft that doesn't have a good result after the surgery, not always to blame the graft or say there is problem with the graft or problem with the eye, always as well put in consideration there could be an issue in the surface of the eye. And we are very happy that after this debridement and epithelial healed back, the patient is seeing much better. And we decided to give a treatment for the dry eye with massive lubricant drops and other treatment for the dry eye. And that's the tip today, that if you have any problem in the vision after a successful graft with no other problems in the back of the eye or the refractive media, so always think about the surface of the eye and put it in consideration. And at the end, I would like always to remind myself and remind you that we are not only treating patients' cornea or eyes, we are helping people to see life. Thank you very much. And if you feel that you learned something from this video, please subscribe in the channel and like the video and share it. And if you want us to do a specific video about a specific topic, please leave a comment here as well. If you have any discussion in this case, please leave a comment, and see you next time.